Hi, I'm Dr. Deva Boone of the Southwest Parathyroid Center. Let's talk about the symptoms of primary hyperparathyroidism. So, most people with primary hyperparathyroidism will have symptoms of the disease at some point. The most common symptoms are actually nonspecific, so that means that they could be present in a lot of other conditions. So the number one symptom of primary hyperparathyroidism, the thing that most people feel, is fatigue. Fatigue can be part of a lot of different diseases, which is why I say it's nonspecific. So just because you're fatigued doesn't mean that you have parathyroid disease. But most patients with primary hyperparathyroidism will develop fatigue. And this is often pretty severe or affecting your quality of life. So it's not just that you feel tired after you run a marathon, it's that you feel tired after you go to work for a few hours, or you normally come home and you've got lots of energy, but now you come home and you have to take a nap. And you wake up in the morning, you don't feel refreshed. It's a different fatigue. It's usually more severe. The other common symptom of parathyroid disease is brain fog, or feeling like you can't concentrate, like your memory is going, like you're just not all there, you're a bit foggy. Again, pretty nonspecific, could be due to a lot of things, but a lot of patients with parathyroid disease do get pretty severe brain fog with this, or even mild brain fog, but they notice it. Another symptom, again nonspecific, is insomnia, and these are kind of the most common ones: fatigue, insomnia, brain fog. The insomnia often presents as going to sleep okay, but then waking up a few hours later and not being able to get back to sleep, which can really affect your day and contribute to that fatigue that you're feeling. In addition to the nonspecific symptoms, there are other things that we see with parathyroid disease that a lot of times people do not attribute to parathyroid disease, but they are related. So common things being like headaches. If you suddenly have daily headaches but never had them in your life before, it could be primary hyperparathyroidism. Heartburn or reflux people start to develop with primary hyperparathyroidism. Constipation, because parathyroid disease or high calcium slows down the GI tract. So constipation is common, and reflux are common with that. Parathyroid disease and high calcium affect the heart, so you can get palpitations, like feeling like your heart is beating faster. You can even get cardiac arrhythmias if you let the disease go. So things like atrial fibrillation can be caused by high calcium, especially if it's gone untreated for many years. Calcium stiffens the arteries, so you get high blood pressure, so your heart has to work a little bit harder, and that leads to effects down the road. So if you have new high blood pressure over the last 6 months or a year, and you're not sure why, or your blood pressure is getting worse and you're not sure why, so now you're on 3 different medications and you can't figure out why you can't control your blood pressure, it could be your high calcium. That can definitely do it. Because the kidneys have to process all this calcium, you can get kidney stones, and you can even damage your kidneys from this. So you can get chronic kidney disease, which can even lead to severe disease and dialysis, again, if you let it go untreated for a long period of time. Parathyroid hormone is taking calcium out of the bones. That's why your calcium in your blood is high, because a lot of it's coming out of your bones. And because of that, you can see bone loss and osteoporosis and even fractures down the road. The bone loss we see with parathyroid disease, you can see it all throughout the body, but if you check a DEXA scan, the area we often see it in with parathyroid disease is in the forearm or the wrist, so the radius. They don't always check that, but anyone with parathyroid disease who's getting a DEXA scan really should include the radius or forearm, because that is often the area where we see the worst bone loss in parathyroid disease. Another symptom is hair loss, especially women may get hair loss on the front top of their head, and don't have any other reason to get it. That can definitely be from the parathyroids. And finally, just having a low interest in things. Again, getting back to the non-specific things, these are often the things that affect people's quality of life the most, are the things like fatigue or not feeling interested in things you used to enjoy, just not wanting to get out there and spend time with your friends. All of these things can be a result of the high calcium, and this can contribute to things like depression and anxiety. So the good news here with all of this is that these symptoms and these problems tend to reverse once you get the parathyroid disease treated. So after you have parathyroid surgery, things like fatigue, brain fog, insomnia, they usually improve in the weeks and the months after surgery. Your bones build back up, and sometimes people can have bone pain actually from the action of PTH on the bones. That goes away after parathyroid surgery, and your bones can build back up. We see improvements on the DEXA scan in the years after parathyroid surgery. So your fracture risk will go down, and you can move out of that osteoporosis range potentially after parathyroid surgery. Even kidney function, so with chronic kidney disease due to parathyroid disease, we see improvements in the creatinine and GFR in the months after parathyroid surgery. And if you don't have any of these issues, if you have parathyroid disease, but you don't have kidney disease and your heart is fine, your blood pressure is fine, that's great. We do know that these things tend to occur over time. So the longer that you let your primary hyperparathyroidism go, the higher the chance that you are going to develop symptoms like fatigue, like high blood pressure, like kidney stones. And we know that if once we do surgery, we are reducing that risk. So we're taking away that extra risk that you have from parathyroid disease by treating it, and we can prevent all these other things from happening. So a lot of symptoms can be caused by parathyroid disease, even things that you might not realize. You might not realize that your headaches or your blood pressure are related, but they are related to the primary hyperparathyroidism. But we can treat this. We can prevent you from getting more symptoms and more problems from it by performing parathyroid surgery. So if you are feeling the symptoms, get treated. If you aren't feeling symptoms, that's great, but let's prevent that from happening by treating it now.